In this video, we'll discuss a common question which I get during my working hours. That is, mostly patients come and ask me, Doctor, what are the procedures which can be performed through a laparoscopic surgery? Or what are the procedures which can be performed laparoscopically? So, today, almost 90% of the procedures which were being done through the open route can be done laparoscopically. For example, the first and foremost, the simplest of all, is the diagnostic laparoscopy. In this procedure, it's usually done for the evaluation of an infertile female. For example, what you do is you enter the abdomen, use your telescope to visualize the uterus, the fallopian tubes, the ovaries, the space behind the uterus, and also the abdomen as a whole, to see whether there are any correctable causes of infertility in the female. If there are correctable causes, then you can go ahead and correct the causes in the same setting. If not, you can even test the patency of the tubes in this procedure. This is one of the most simple laparoscopic procedures done. One step ahead, you can go ahead and do a laparoscopic sterilization. Once a lady completes a family, in order to prevent further pregnancies, you can go ahead for laparoscopic sterilization, where you apply certain rings, certain silicone rings called fallope rings on the tube so as to block the patency of the tube. If there are cysts which are found in the ovary or maybe both ovaries, these cysts can be easily removed laparoscopically. So this procedure is called as laparoscopic cystectomy. And further, when there are masses in the uterus, which are usually outgrowths of the muscle layer of the uterus, which are called as fibroids, you can safely remove these fibroids through the laparoscopic route. This is known as laparoscopic myomectomy. Irrespective of the size of the myoma or the fibroid, you can remove the fibroid laparoscopically if you have the skills and expertise for it. If the female has completed her family and is having some issues with the uterus, for example bleeding problems, or there are multiple fibroids, or be it any reason for which the uterus is to be removed, then this procedure can also be done easily through laparoscopy. It's called as a total laparoscopic hysterectomy. Nowadays, most of the uteruses are being removed laparoscopically, and laparoscopic hysterectomy is one of the most common procedures being performed by a gynecologist. Of lately, many cancer surgeries are also being done laparoscopically, be it the cancer of the cervix, be it the cancer of the uterus, or be it the cancer of the ovaries. There are a lot of cancers which are being operated laparoscopically, because over the time we have developed the technology and the skills for it. With the right skills and the right technology, nowadays you can perform almost any procedure laparoscopically which was earlier being performed through open surgery.